I'm obstetrician gynecologist, but I'm double boarded. I'm also board certified in urogynecology, female pelvic medicine, reconstructive surgery, and I specialize in minimally invasive surgery. And a lot of people don't understand that is different than obstetrics and gynecology. As I have aged, I have moved further away from the obstetrics. I still do obstetrics, but my main focus is urogynecology, which is helping with bladder control, bowel control issues, pelvic support issues, and then minimally invasive surgical techniques. My father was a small-town physician in the southeastern portion of Kentucky, and was one of the only doctors in town. So I grew up watching him and seeing how he was able to impact the lives of his patients, and wanted to be just like him. So when I was a little boy, about 7, I sat in his office and said, "I'm going to do exactly what you do." So I applied to the same college he went to. I applied to the same med school he went to. Those are the only 2 schools I applied to because I knew I'd go, and I had my plan set. How long have I been a doctor? I've been a doctor for a long time. I graduated medical school in 1990, delivered my first baby in 88. So babies that I delivered have had babies, and their babies have had babies. I chose my specialty because I saw a unique opportunity to be involved in one of the greatest miracles that we ever get to experience, and that's the birth of a child. When I started my OBGYN portion of medical school, I fell in love. The idea that you have the opportunity to help bring life into the world and to see the miracle that God created when it came to these babies. I mean, a baby goes from inside mom to breathing air in a split second. When the baby takes that first breath, all these things happen that allow baby to breathe air for the first time. And only an amazing engineer could have designed that. So that miracle is something I like being a part of and enjoyed. And then the surgical part of the OBGYN I fell in love with as well. And now as I've evolved in my practice, I'm more with the surgical portion than the obstetrics, but I love it all. I think I'm most passionate about the opportunity to impact the quality of patients' lives on a daily basis. Being a urogynecologist and minimally invasive gynecologic surgeon, I have the opportunity to try to do that in a way that gets them back to their normal lives as quickly as possible. And exploring new techniques, new technologies is something I'm very passionate about, because as we evolve in medicine, we can't remain stagnant. We have to take the opportunity to make things better and move that direction. And I've always done that throughout my career. I think that as a physician, we are here to try our best to inform, and then we can partner with the patient so that they can make the best decisions for them and their life and their family. So there aren't any dumb questions. When I'm not working, I love spending time with my family. We have 5 children and almost 6 grandkids, one on the way. So we've been very blessed, and my wife and I love to travel. Scuba diving is something I enjoy. I haven't gotten to do much of that lately, but I really miss it. I love to golf. I have trained martial arts for years. I haven't recently, obviously, but I enjoy it, and I like to keep up. Had a couple of opportunities to do some mission work, which it's really impacted my life. Went to Africa. Was able actually to meet my sponsored child there, named Voyo. Getting the opportunity to see these children and how little things in their life have such a huge impact impressed upon me how important it is for us to pay attention to those little things and to be very thankful for what we have. And I've tried to instill that into all the children that I encounter in my life.